A scheme involving genetic testing that targets seniors has surfaced in our area, and the FBI is warning the public about it.
Our consumer investigator Kristen Byrne explains how a local couple fell for that fraud.
Within minutes after a package was mailed to TG and Alan Levy's Milwaukee County home,
he was from the lab and he sounded very professional, and he was also very personable.
They got a call from an unknown number.
He had our telephone number and he had the name of our primary care doctor. Okay, so he said that the doctor had ordered this test for cardiac.
Inside was a test tube and directions for TG to do a cheek swab for a cardiac DNA test.
I've had cardiac issues, so saying they were going to test for cardiac issues, seemed to make sense.
And my father died when I was 12 from heart disease.
Alan ended up following the same process. Again, a package arrived with a testing material, and a man from the lab walked him through it.
So it seemed normal.
So it seemed like it was part of that process.
The couple has a new doctor and thought this was nothing out of the ordinary. Weeks passed, and then the links holding this genetic testing story together started to unravel.
So now it's about 5 weeks later, and we call the doctor to say, did you get the results? And the doctor said, responds with, I don't know what you're talking about. I didn't order anything like that.
And that's when we knew it was the scam.
And that's when we started to get suspicious.
Anytime anyone calls you, basically cold call about any type of test that you should take, DNA test, genetic test, even if they'd have your doctor's name by chance, it is most likely a fraud.
Supervisory Special Agent with the FBI, Christopher Farrell, says what happened to the Levys is all too familiar. He says criminals submit medical tests to bill Medicare and pocket the money. The U.S. Department of Health and Human Services has warned the public about this kind of fraud, stating scammers offer Medicare beneficiaries these free cheek swabs for genetic testing to either obtain Medicare information for identity theft or for fraudulent billing purposes. According to the FBI, the DNA isn't what the con artists are after.
Can that be used for some type of criminal activity?
No, usually it's not. So the test is a real test, right? And it's going to a real lab.
Just your doctor isn't involved.
It's a complicated and complex scheme that involves multiple people and even kind of companies that come together to engage in this type of healthcare fraud.
Health and Human Services says if Medicare denies the claim, there's a chance you would be stuck paying the cost of the test, which could be thousands of dollars.
This isn't fun and games. This is financial gains.
TG and Alan haven't seen a bill for the test. They called Medicare, several federal agencies, and local police to report what happened. They were told to monitor their Medicare claims.
And so if we see something that's not paid and it's a lab,
we're going to know.
Or whatever it is, we're going to raise the question immediately.
Looking back, TG regrets answering that unknown number and trusting whoever was on the other end had her best interest at heart.
I thought that I was smart. Evidently not.
Since the Levys didn't think anything was out of the ordinary, they didn't take any photos of the package or of the testing materials, and they didn't write down the sender's name or number. So investigating their case could be hard because they don't have the evidence. Even so, they told me the entire purpose of telling their story is so that they can warn other seniors about this scheme. I'm consumer investigator Kristen Byrne.